Hi, my name is Shannon Long, and I'm here today to talk to you about our organization, some areas of weakness that we have, and some potential strategic improvements that we can make. I want to first start by reviewing our mission and values. Our mission as an organization is to inspire hope and contribute to the health and well-being by providing the best care to every patient through an integrated clinical practice, education, and research. Our primary values include respect, integrity, compassion, healing, teamwork, innovation, excellence, and stewardship. In our transplant center, we have been working over the past several years to become one of the largest centers in the country. We are now the 5th largest program in the country. Despite our growth, we have been able to maintain our outcomes to compare favorably with the national averages. Currently, we have 965 patients listed for kidney transplant. Of these 969 patients, 458 of those, or 47%, are status 7 or inactive on the list. On a national level, the average percentage of patients status 7 is currently 30%. In addition, the average number of days a patient is inactive is about 350 days. Our average is currently 469. As you can see, we are currently above the expected national levels for these two measures. This is a concern for us as a transplant program, as these two metrics began to be factored into our overall transplant score at the beginning of 2017. This score is available to the public. It's on the United Network of Organ Sharing's website for the public to view. It's also provided to the patients on our waiting list in writing, and it's factored into our reimbursement payment schedules that both Medicare and Medicaid use. In addition, other insurance companies like Blue Cross and Blue Shield, Cigna, United Healthcare, to name a few, will use these scores to help factor in to who their designated transplant centers are. Currently in the time that we are in, we have an organ supply that is decreasing, and the number of patients on the waiting list is increasing. It's more and more important than ever to keep our patients healthy and able to receive a transplant while they wait. We have to remember that some of our patients can wait 3, 5, maybe 7 years to receive their kidney transplant. What we don't want to sacrifice is the needs of our post-transplant patients and our patients currently undergoing evaluation to get them on the list. We want to, in order to meet this goal, we need to remember keeping everybody on the list and ready to be called in may not increase the number of kidney transplants or the number of kidneys donated. However, we can only transplant active patients. So these inactive patients are not part of the allocation process. So to help increase the number of patients on our list that are transplanted, getting them active as soon as they are ready is in their best interest. Our strategic goal to improve these two metrics is to decrease the percentage of inactive status 7 patients by 10%, and decrease the patient's average number of days spent as inactive within the next 2 to 3 years. The other things that we want to do is increase our patient satisfaction, which will be easy to do by managing these inactive patients effectively. We're going to be interjecting with them more, touching them more routinely, and cultivating relationships with them. This is going to create positive feelings from the patient, and that will then reflect upon our transplant center. These feelings that they have, these positive feelings and interactions that they're having with us as we cultivate these relationships and get them moved from inactive to active status, is something that they will talk to their primary nephrologist and dialysis center about. These providers are a referral source for us. When they hear their patients talking about the good relationships they have with us and how we've helped them through this process, those doctors like to hear that. They like when their patients are happy. They like when their patients are well cared for. So this can potentially increase the number of referrals that we get into our transplant center as well as increased reimbursement for us as well. To achieve this strategic goal of decreasing the percentage of inactive status 7 patients on the wait list, we have a few items that we can do to achieve this. First, we need to develop a tracking tool to monitor completed testing and consultations. Nursing informatics and information technology department is going to be with us through this, helping us create this. We want to meet with them and our frontline workers, which include our waitlist coordinators. And our management staff to create this tool. We want an easy to use tool, a simple to use, easy to read, including all of the vital information that we have on a patient, including the patient's testing, consultations, and clearance requirements in order for them to be made active on the list. We also want to include when these items will be completed and when they will be due again. A time frame that we have set to create this tracking tool is 3 to 6 months. We don't want to push that to have an inadequate product, but we do want to get it out as fast as possible. We want to be able to test it. We also need to be able to train our staff on all of its capabilities and its function. Our next step to achieving this goal is to create a dedicated multidisciplinary team. This team needs to include one of our transplant nephrologists, one of our transplant surgeons. We need social work involvement, and our nurse transplant coordinators. This will allow for a more careful monitoring of patients' conditions so that these patients can be reactivated as quickly as possible. This group will meet at a designated time on a weekly basis. The number of patients reviewed in this setting to satisfy the goal to go through our list within a 6-month period would be about 25 to 26 patients reviewed on a weekly basis. We also want to review our status 7 patients with the waitlist coordinators. We're going to require our waitlist coordinators to have frequent contact with the patients. It allows us to identify candidates with disqualifying conditions. We're going to work with candidates to get pending items completed. And what we want our target to be is our waitlist coordinators touching these patients on a quarterly basis. We also need to increase our education to our patients and staff related to our patient portal. Our patient portal is our electronic communication system with patients. The use of this portal by patients and us can cause increasing satisfaction, an easier way for patients to get a hold of us, and just more technology at their fingertips of them being able to go into their chart, see the notes, see what is pending, so that they can be more engaged in their care too. And then obviously, lastly, we need to make sure that our teams and our staff is educated on the wait list and the issues that keeping patients inactive on the wait list can potentially cause for not only the transplant center but the patient themselves. And I think more importantly is patient education. A lot of times our patients think that because they are listed on the transplant list that that's all that they need to do, and they don't thoroughly understand the difference of their statuses between active and inactive. So doing thorough education with them so that they can understand what this means, and that being inactive, that they have pending items that we need to ensure, but they also need to have responsibility in making sure those items get done as well. In order to meet this goal and to make our action plan successful, we need to be able to communicate that with our staff. We're going to use several measures in order to do that. We want to have some face-to-face meetings with individuals and groups explaining why we are doing this, why we are trying to achieve this goal and the impact that it's going to have on our patients. We're going to use electronic communication to kind of drill that down for them, show them where we're currently at, what the national averages are, and what that means to us as a center on our overall transplant score. And we're going to have one-on-one discussions where the frontline workers, we can review the plan and assess how they're doing and what they feel is their barriers to doing more frequent reviews, being involved with a multidisciplinary team, and the use of a tracking tool. What we want to use as our control method is a balanced scorecard with a balanced scorecard, we're able to measure the number of our goals against our vision and our mission as an organization. It's going to help us to develop our short-term and long-term goals, set our performance targets, and evaluate needs and reassess those. It's also going to help us track our improvement efforts. The way that we're going to monitor this and measure it is through monthly reports. We're going to create monthly reports where it's going to show us the number of patients that are listed, the number of patients that are active on the list, and the number of patients that are inactive. We want to do a baseline patient satisfaction survey so that we can see kind of where we're currently sitting. We want to see that number stay the same or improve, and we're going to do those patient satisfaction surveys on a quarterly basis to ensure that by doing this extra monitoring and extra follow-up of our status 7 patients, that we're not decreasing our patient satisfaction in other groups as well. We also want to look at our baseline operational costs and see the decrease. We want to see a decrease in our operational costs over the next several years. The tracking and management of status 7 patients is a costly factor for us, and to show how managing this group effectively can decrease our overall costs while increasing our reimbursement is something that we want to follow. We're going to do a quarterly review of these metrics at our transplant all staff meeting to discuss our achievements, what our failures were, if any, and what limitations of these goals we have. On our monitoring metric that we're going to supply to everybody, we're going to use a red, yellow, and green kind of signification. If a measure is in the green, it's good, we're not seeing any issues. If something is labeled with a yellow, that is something that is at risk and we need to look at and prepare and see if we can make that better. Red is an item that is currently not meeting what we expect to be met. And on those items, we need to sit down and develop a plan of action to improve those failures. We will, like I said, do that on a quarterly basis until we feel that the goals have been effectively met and that we can then close out the goal. At this time, I'm going to open everything up to questions and see if there's anything that I can further answer for you.